Hello and welcome, everyone. Thank you for joining us today. I'm Steve Sapienza with the Pulitzer Center. We'll get started here in a few moments with today's conversation about a topic that's top of everyone's mind these days, COVID vaccines and combating misinformation. This event is being co-presented by the Pulitzer Center and the Howard Hughes Medical Institute's Department of Science Education. We have a dynamite lineup of experts to help guide us through some misinformation and confusion that has been surrounding the COVID vaccines rollout. And we thank you for taking time out of your busy schedule for this very timely discussion today. As we wait for more folks to join, I'm going to tell you a little bit about the Pulitzer Center. For those of you who have not joined us before, the Pulitzer Center is a nonprofit journalism organization, and we're based in Washington, D.C., and we support more than 170 reporting projects each year around the globe, and focused on global and local issues. On our website, you can take a look at these reporting projects under our issues page, and we bring together this work that includes many different types of themes: racial justice, indigenous communities, the environment and climate change, migration, and you'll also find many fine reporting projects related to COVID-19 and public health. We have developed a very strong university program connecting journalists with college campuses in person and now virtually to engage students. We're also award reporting fellowships each year to students from more than 30 of our university college partners. On the K-12 education front, we reach thousands of students and educators via class visits and online sessions and professional development workshops. We also organize public events and issued focused webinars such as this one. You can find all the reporting and educational resources on our website, pulitzercenter.org. Now for a few logistics before we start. I'd first like to just tell you how you can participate, our audience can participate in the conversation today. You'll see a question and answer Q&A icon on your screen. You can begin adding your questions at any time throughout the remarks. Please go ahead and do that as soon as a question or something you want to relate comes to mind. There's also a chat icon on your screen, and we'd appreciate it if you use that chat box for specific technology problems or issues. You should know that all the attendees are muted, but if you cannot hear us, please let us know via the chat box. We want to let you know that we are recording this session to post it online for others who could not join us today at a later date. One final logistic note, please remember to stay online after our session to participate in a brief survey. We'd really appreciate that. We are also live tweeting this event today, so please use hashtag viral questions to join in. Now I'd like to introduce our lineup. George Benjamin, Executive Director of the American Public Health Association, which is the nation's oldest and largest organization of public health professionals, is here. Heidi Larson, who is an anthropologist and director of the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, and author of Stuck: How Vaccine Rumors Start and Why They Don't Go Away. Carol Tavris, social psychologist and co-author of Mistakes Were Made, But Not By Me: Why We Justify Foolish Beliefs, Bad Decisions, and Hurtful Acts. And our moderator today is Lauren Neergaard. Lauren is an award-winning medical writer for the Associated Press based in Washington. She joined the AP in Atlanta in 1989 as a general news reporter. In 1992, she began focusing on health, covering the Centers for Disease Control and Prevention, and she transferred to Washington in late 1993 and covers public health and medicine. Thank you, Lauren, for handling the moderating duties, and we now hand the mic off to you.
Thank you, Steve, and thank you to our panelists. This looks to be a really interesting conversation today on the challenges of vaccine misinformation. And it's actually an interesting conversation to be having at this point in time, considering that there is such a clamor for our scarce supplies of the first vaccines that are rolling out. But that being said, there is real concern about how many people will actually get in line once there are more supplies and it's their turn. Adding to some of the confusion that's out there is the fact that there are many different types of vaccines that are being rolled out in different parts of the world. They work differently, they're made differently, and the degrees of scientific information behind them also is different. So there are lots of questions that people have. We're going to start with some opening remarks from each of our panelists to talk about the challenges that we all face in this current situation. And we'll get started with Carol Tavris.
Well, thank you very much. First, I want to say how pleased I am and how honored I am to be part of this discussion. The whole issue of vaccines, actually, I realized, crystallizes for me my own life trajectory as a social psychologist and science writer. Because when I started out, my focus was on persuasion and communication. Look, I have these fantastically interesting studies to show how they will improve your life and that will explain how things work. And isn't this really fascinating and interesting? And to my surprise, as a naive young science writer, many people did not jump up with excitement and say, why, thank you for this important information. You mean memory isn't implanted in the brain and I can uproot it like a turnip in therapy? How fascinating. Very often people would say, you know, piss off and take your stupid studies with you. So the second phase, in a way, of my life in science writing and in bringing good psychological science to public attention was to focus on the question of why some people are open to new evidence, welcome new evidence, are grateful for new evidence, and are able to give up old ideas and beliefs in the face of new beneficial evidence, and why others double down and reject it. So when Elliot Aronson and I began work on Mistakes Were Made, the really interesting question to us was, or I should say the issue to us, was to explain the mechanism that accounts for the apparently irrational, if not crazy, behavior of people. You know, so for example, you see a woman screaming in a supermarket at the manager telling her she has to wear a mask. Why is she screaming at him? Because she won't wear a mask. We see the end stage of a commitment to a belief that takes people from an early decision, I'm not wearing masks because I'm loyal to the president and he's not wearing a mask, to screaming in a supermarket, which is to say, when people first make a decision, I'm going to use a vaccine or not use a vaccine, whatever the decision might be, they will then want to justify the decision they make because, after all, they're smart, reasonable people and they only do smart, reasonable things. But with every step along the path of justifying that first decision, it will take them further and further away from the ability to let that decision go and change their minds. So what we are seeing now in our country here in the United States is a vast polarization between those who have become committed to, you know, COVID is a hoax, I'm not wearing a mask, I'm not taking a vaccine, and those who are jumping all over each other to get in line for a vaccine, knowing that it is the way out of this nightmare. So for me as a social psychologist, there's two steps here. How do you change attitudes so that people's behavior will change? And if their attitudes won't change, then how do you get them to change their behavior so that their attitudes will follow? Those are the two central issues for social psychology.
Okay, thank you, Carol. That's you've given us a lot to chew on here at the very beginning. George, let's move on to you and get that public health perspective.
So I think, you know, anytime you're trying to address an issue, you have to really understand the problem you're trying to address. And from a medical perspective, let me just let folks know where we are today. We're at almost 25.5 million people in our country with this disease and over 100 million people worldwide. We have eclipsed over 425,000 deaths, more than in a year, basically. And that is more than the number of people who died from the US in World War II in 6 years. We have communities that are ravaged by this disease. people out of work, and economic devastation. And yet, we have people that A, don't believe the disease exists, don't believe in the tools that we have to prevent folks from getting infected in the first place. And I'm talking about primarily wearing a mask, washing your hands, and keeping your distance from other people, realizing this is a disease that you get from other people. And, you know, in many cases, just deciding that, you know, it's a crapshoot and I'm just simply gonna go out and do what I wanna do without any protection at all. And then tragically, as you heard from Carol, in their belief structure, finding ways to defend it in a way that I think most of us would seem to be fundamentally irrational. And yet you don't want to demonize people. You want to accept them for who they are. One of the things that I learned, I spent this first half of my career practicing medicine, and I learned a lot that you have to start from people where they are. And when you give people medical advice, it isn't a command, it is indeed medical advice. And you have to find a way as a physician, at least, and my nursing colleagues tell me it's the same with nursing, that you have to be able to build the kind of relationship with people that is trusting, so that they will take your advice and go forward when it is your best advice you can give them. But that tends to be a challenge. So I think what we want to talk today about is some of these decisions that people are making in light of the facts and what we actually know about human biology. And also the fact that we have a tool, particularly vaccination, that has so far been very much demonstrated as both safe and effective, and the challenges that we have in both proactively communicating that and dealing with disinformation, because there is a force of people out there who are purposely giving people the wrong information that tragically will impact negatively their health.
Okay, thank you. Now we'll move on to maybe a more international perspective with Heidi. So take it away.
Thanks. Well, George was a great bridge to what I was going to focus on, which is really trust. And I think that in the decade plus, I founded the Vaccine Confidence Project just over 10 years ago. And it was because of the 10 years before where I was working with UNICEF as the global immunization communications and strategy person for introducing new vaccines, and started to see this, and this is back 20 years, started to see this epidemic of small groups of people resisting and questioning vaccines. And UNICEF wasn't used to being told, we don't want the good things you want to give us. So I, being an anthropologist, got sent out there to say, figure out what's going on with these people. And it was amazing. I mean, in Hanoi, in Tehran, in Bosnia, in Ouagadougou, I mean, I was hearing all kinds of different but similar things. And I just felt like we weren't paying enough attention to this emerging issue, and nobody really wanted to hear about it. And I thought I was being negative. And
what were the things you were hearing? What were they saying? What were the things you said they were all saying? You were hearing these unusual things. What would they all have in common that they were saying about?
Yeah. I was just gonna.
I'm sorry.
That's okay. And so I thought we needed to. I mean, the one thing that everyone wanted to hear is, how big is it? How many of them are there? They were less interested in what the people were saying, which basically all came down to trust or distrust. It was that they. One, why do you keep coming in the case of polio? Why do you keep coming back with the same thing when that's, you know, our kids are dying of measles? You know, there must be something trust basically, and is mostly defined in the philosophical literature as two things. One, trust in the capability, the ability, competence of the person or institution, and their motive. Are they motivated in my interests, or are they motivated to put a few extra dollars in their pocket or whatever, or to look good for their supervisor? And we saw again and again an anxiety about motive. Why are these big global institutions, why would they pay so much for all this? Why do they want to count people? Why aren't they taking care of all my other health needs? And why are they just picking this one thing? And it really struck me that basically they just felt like they weren't being listened to. They weren't, and getting back to George's point, we weren't putting ourselves in their shoes. We were totally driven by getting, as they call them here, the jabs in arms, and counting. And that's really was the metric of a health worker's performance in some setting is, did you get those 100 people? Not how were those 100 people, or were there other issues with these people? And it was a real issue, but it was very hard to get attention to saying, listen, guys, we need to engage differently with our outreach. It shouldn't just be get vaccinated. It's good for you. The push strategy is starting to push back. We need to work differently. And I eventually realized that the only way I was going to get any attention to this issue was to start to get some measurements around it, to see how big it was, to see what was going on. And basically, we developed a vaccine confidence index that we've been measuring, and we can see trends. Some people get better, some countries get more confident, some get less year to year. It changes, and the whole idea is we can pick up these changes in sentiment and try to get ahead of this curve of misinformation or distrust, and try to get in there. What's been fascinating to us in our group, and partly on the one hand, I think the public health community thought, okay, with something as big and bad as COVID, people are going to come around to finally seeing the value of vaccines. Well, we've seen the amplification of kind of anti and vaccine critical sentiment online, and we really are very global in our listening, has absolutely amplified and gone into social networks and groups that never talked about vaccines before. And there's been this whole coming together, and a lot of it's against, for those who are against government control. Some of it is against safety issues, some of it around other issues. But basically, we're in a time of hyper uncertainty. I don't need to hear it from me. And absolutely fertile ground for rumors. But I think if I have one thing to say here is that there's a lot of pieces of information out there. Even the science is uncertain. We have to, I think if there's one message, have empathy with people. It's not only tough for all the reasons that, have been mapped out here. It's tough, and we have to have empathy. And I think from a writing perspective, from a journalism, from a communication perspective, we need to put vaccines in the context of a journey towards getting ahead of COVID, not a journey to get everyone vaccinated. Because in the meanwhile, we're going to need to keep our masks on, we're going to need to do our social distancing, but we need to take care of the hearts and souls of a lot of people along the way. So I think, as they say in the marketing industry, when you're trying to sell airplane flights, you don't do it for the airplane flight, you sell the beach. You sell the destination. And I think we need to think about it that way.
Thank you, Heidi. You're bringing up some very scary trends here, and actually, one of our first questions that has come up from our viewers is how the anti-vaccine phenomenon is evolving during the pandemic. I guess the extension of that question is then, do you as folks who are involved in trying to instill vaccine confidence, are you coming up with different ways to approach it and different ways that are customized for different communities? Is this a matter of, do you pull out the charts that say, well, here are the side effects when somebody says, I'm scared of a side effect? Or is it more of a conversation about, well, why are you scared? What can I tell you?
Well, I think what everybody has agreed on is that you start with where your recipient of your message is. I think we all know that just providing information, here's the statistics, people turn off to this. People live by stories and think in stories, and that's why one anecdote carries often more weight for people than the actual statistical information. And because there's so much emotion involved. One of the key things we do know in persuasion, what do people like to say when they want to persuade you of something? What were you thinking? What were you thinking? Why aren't you taking a vaccine, you twit? And of course, what the person is going to say is, what I was thinking was, I'm really very smart and reasonable to not take a vaccine. You don't put a recipient of your message in a position that makes them feel foolish or incompetent for holding that position. And so, as Heidi just said, you have to start from where they are, what their worries are, what their fears are, what their feelings are, to try to acknowledge those underneath the expressed opinion. And so that's a very different lesson for how to communicate the importance of the nature of vaccines. And as she also said quite rightly, it's about trust in our institutions. Who are the experts we want to listen to and trust? What are the institutions we want to listen to and trust? What can those do to instill that trust? And by the way, just to make life even more complicated, one of the really difficult things scientists have is that scientists speak in probabilities, and scientists change their mind when new information comes along. This is extremely irritating to many people who really don't know how science works. They say, see, you keep changing your mind. Why should I listen to you now when you had a different view 6 months ago? And so they're looking for certainty and reassurance and a one size fits all. If I just avoid this vaccine, then I'll be safe, rather than having to rethink the evidence and change my mind.
Anybody else want to jump in? Dr.
Yeah, I think that the reason is I tell people you have 2 ears and 1 mouth is that when you're trying to deal with patients who have some degree of skepticism, you have to listen to what their concerns are. There is not one belief by anybody. There aren't vaccine skeptics that have one view of the world. Their reasons for not wanting to be vaccinated are highly variable. From, if you look at what happens with kids and their parents with childhood vaccines, the fact that parents believe in vaccines is wonderful, but they may not want their child to get 4 vaccines on an individual day for a variety of reasons, just from the fact that it hurts, or the fact that they're concerned about medication interactions because I've heard a lot about medication interactions. And someone may have very well told them that, well, my experience was when I had my children that I spaced them out, and you don't have to take them the way the doctor tells you have to take them. So of course they care about their kids, and therefore they want to, do what they view as the best thing for their children. And of course, the clinician's view of the world is we know it's safe, we do it all the time, it isn't a big deal. And you have to broach those two perspectives. And if you're doctors' offices are very busy. They want to get the patients in and out. There are billing issues, there are timing issues, there are appointment issues. If I don't give the child their shot today, they won't get it for another 3 months, whatever the issue may be. With this particular vaccine, the fact that as a nation, we've been having a very public discussion, which normally doesn't happen, by the way, about how the vaccine is made, how it's new and novel. So many things that people would not have normally done And quite frankly, most consumer products, people don't go through this kind of debate publicly. It just looks neat, so they buy it, or it tastes good, so they eat it. Well, we've had a public debate about this vaccine. And so people need to recognize the environment in which we're encouraging people to get the shot. And we've not done a really good job of saying, here's what happens if you get the vaccination, and here's what happens if you don't. And we've not married those two stories in a compelling way for a lot of people who are fundamentally hesitant, nor have we answered in a compelling and very frequent way common sense questions such as, can I take this vaccine? Does it impact my taking any of my other medications? We hear that people who have COVID, who have heart disease and lung disease, get sicker. Well, now you're giving me this vaccine. Won't I get sicker if I have heart or lung disease? Of course, the answer is no, because you're not giving them a live virus. But we've not broken up that communication into everyday language to answer people's everyday questions. And you have to do that up front. So you have to take all the common questions off the table as part of the communication. And then quite frankly, people were more afraid of the hesitancy than the shortage. So we can talk about that as well. But I think that there's never been a thoughtful communications plan put together, which should have been done last spring when we were doing a more thoughtful plan to create the vaccine.
And just to follow up on that thread, do you have a sense that that's now going to come, that maybe the idea was, well, first we're focusing on vaccinating healthcare workers, they ought to know. And now we've got to have more of a broad education campaign. And if not, where should people be going to find this information?
There are efforts to do that, and that's true. And the Ad Council has done a series of focus groups. The Reagan-Udall Foundation has done a series of focus groups trying to understand where people are, how to adequately communicate with them. Frank Lutz, who is a conservative pollster, has looked at communities. He's also gone to more conservative communities and looked at language that is more appropriate for the various interest groups and based on what people's life experiences. And so words to use and words not to use are being passed around by people who are now trying to communicate this. Just to give you one example, it's important to talk about the scientists, the people behind the research, because they live in our neighborhoods and they're just like us. It's important if you're talking to African-American communities to point out the fact that unlike Tuskegee, there were many African-Americans involved in these projects, including the Moderna vaccine. One of the lead researchers is an African-American researcher, very, very bright lady. On the other hand, don't talk about the pharmaceutical companies. The pharmaceutical companies aren't necessarily viewed by many people as trusted these days. They're great companies, I love them, but you talk more about the people and not the companies is one example of way to communicate more effectively when you're talking about these vaccines.
Humanize the story. Humanize the story, right? Make it personal and real. I have a question for you both, if I may, which is that we've been talking about how to change people's hearts and minds and souls and their willingness to accept vaccines. But as we all know, it wasn't changing people's hearts and minds that got people to quit smoking, wear seatbelts, and wear motorcycle helmets. That at some point, the laws and the peer norms had to change so that you had to get a vaccine if you were going to go to school, right? Or, you were going to get a penalty if you didn't wear a seatbelt. And pretty soon, all that stuff about it's my right to freedom to not wear a seatbelt. I'm not wearing, any sissy seatbelt, and you never hear that anymore, right? So in a way, my question is sort of the second piece of the social psychological approach, are there social, systematic, legal rewards and punishments that would require more people to get a vaccine in order to fly, in order to travel, in order to go back to work, and so forth? Are you looking at this in terms of changing the behavior of the people who are opposed strongly?
Well, I'll jump in, and then George, I'm sure you have some thoughts on this. I just did an article with Larry Gostin and Dan Salmon called on COVID vaccine mandates and things to consider in JAMA. And it's, I don't think we're in a position to, well, we're definitely not in a position to be mandating or making the COVID vaccine compulsory. One, you can't mandate something you don't have enough of. And also it's still, in a lot of places, still under emergency authorization. So, and in general, you don't do mandates for population wide. It's usually setting based, like going to school. When an individual puts other people at risk, healthcare workers in a hospital, whatever. Countries can require vaccinations, like, in a number of African countries, you need your yellow fever vaccine. If you want to go on a Hajj pilgrimage, there are at least 3 vaccines they require to get into Mecca. And I could easily see that as it's a mass gathering. I could easily see them adding COVID to that list. But I think in the current environment with such dissent and anti-sentiments against the amount of government controls right now, I think it would be a tough call. I don't think it's feasible in some settings. Some are talking about fines or whatever, but I think we're not in a position certainly yet, and we'll see it. It may be setting based, but George, you look like you had some.
Yeah, I would agree. We don't have enough to start with. Number 2, you don't mandate a product that's not fully licensed. Number 3, at the end of the day, if we want people to get vaccinated, you don't tell them to do stuff. The more you demand people do things, the less likely you are to get compliance from some people. And unfortunately, this has been politicized so much that I think that the compliance problems would be enhanced. And so I think that for me, the best way to deal with recognizing most people are hesitant, not that anti-vaccine, that we can give people the knowledge about the vaccine to allow them to take it. And remind you that the implications behind this vaccine also go to other vaccines. The fact that this is not the only vaccine we want people to take in their life, we need to be very careful and think of this as part of a suite of vaccinations and the overarching vaccination message. By the way, mRNA vaccines are probably going to be used a lot in the future as anti-cancer tools. And so we need to think about the future of this technology as well. And hopefully we can get people to understand it and recognize it's safe and effective, because this is not the last vaccine that's going to be using this technology. Flu vaccine is made by, you got to have chickens, they got to produce eggs, then we got to inject the eggs with the virus. It has to adequately grow. We then cultivate it, and then we make the vaccine. We've been doing that for many years, and we have been trying very hard to figure out a new technology for flu. And there's all kinds of reasons that flu vaccine production line isn't ideal, but it is relatively reliable. So this new technology gives us an opportunity to do something different. By the way, there are also looking at newer technologies, RNA and genetic technologies beyond this one. So again, people ought to recognize that this is just the tip of the iceberg.
There's a lot of questions in the queue that have to deal with the idea of, it's kind of hard to convince people one-on-one. And there are also specific groups that have specific kinds of questions. Certainly communities of color have been really ravaged by this disease, and also would have specific questions about whether to trust the vaccine, given, as you brought up, Tuskegee and other historical problems. So what are some culturally competent ways to engage different communities with the right message? I have actually been struck by how often I've seen pastors, hosting social media question and answer sessions with people like Dr. Fauci. So can you talk about that? Any of the three of you?
Well, it's certainly something that globally we try to do, and I think is equally relevant now with any communities that, I mean, this comes back to the trust issue or distrust issue. When I think particularly it's not just individuals that have historic memories, but communities, as we know from Tuskegee, but even just people's experience in a clinic, if they feel like the healthcare worker or the clinic was not, didn't treat them nicely or was judging them, they might not want to go back for the next thing, whatever it is. But in terms of your point, I mean, I do think in finding out who is the right trusted leader, and not just to assume that it's the official local leader, and that really varies. And there's probably a few different ones even within a community. I mean, we see that we had some issues here in the UK, not unlike what we had in India and some other parts of the world with the nasal flu vaccine that has a gelatin that it stays in the nasal. And it has porcine in it for the gelatin, and that created some anxiety among some imams. But I had mentioned this early with Public Health England, but they said, don't worry, the Organization of Islamic States had approved it with WHO, but that's far away from a local imam, and what people listen to is what their local leader has to say. And we had a few communities here who were worried about that because it's not from a safety, but against their religion. So the way to get there was really going through imam, and we had similar issues with the Catholic Church, having to go to the Vatican to get them to reach out around some issues and anxieties around sterilization or fetal cell lines or other things. So it is not always religious leaders, but it depends on who your community is.
Who your community is exactly right. And as you say repeatedly, it's about trust. I'm interested in the rise of concierge medicine in the United States, which is a way for middle class and wealthy people to get attention, to have time with a physician who will pay attention to them. Some of the concierge practices offer maybe not even such good medicine. In the case of the menopause clinics that are proliferating, it's a way for women to come and talk about their issues in midlife and how should I treat this, and do I want some supplement that will help my symptoms. It's for the attention, for the validation, for being heard, for being listened to, which is so critical. And as George was saying, this is so often lacking in modern medicine. Doctors don't have the time to explain, to reassure, to start from where the patient is with their concerns. And of course, as we know, sometimes patients can't even identify what their concerns or fears are until they've had some conversation with the physician. So it is to do with community and having people whom you trust in your community to be your go-to people. No Republican is going to listen to any Democrat tell them about vaccines or Dr. Fauci, right? It's so polarized here. But within your own identity group, then you're more likely to be open to what a friend, colleague, or even scientists will say.
No, I would agree. And I as an African-American male, I'm always fascinated by the issues and mistrust that of course occurs in communities of color. And obviously, faith leaders, Mrs. Jones down the street, Mrs. Jones, Everybody goes to Mrs. Jones for advice. You got to figure, every community has a Mrs. Jones. The men do it too, but it's usually in the barbershop. And everybody has the community person who they go to for advice. It may be a family member too. And you have to infuse the facts into the community in a meaningful way, but also realize that there are distractors out there. You know, early on, there were a lot of people, last spring, there were a lot of people talking about, there were flyers flying around in African-American communities before we had a vaccine, telling the African-American community, don't get the vaccine because it will give you the disease, give you AIDS, you know, make you sterile. Those are the three common things that they put in there. And we didn't even have a vaccine then, but these were anti-vaccine communities that were proactively engaging communities with a fair amount of disinformation. And when we talk about the historical distrust, well, Tuskegee was a terrible thing, but I remind people that it was the withholding of treatment, which was the real sin there, and made that experiment a terrible experiment. And what I point out to communities of color is that we're disproportionately impacted by the disease if we get infected, both hospitalizations and deaths, and the withholding of the disease, i.e. withholding of the vaccine in it itself would be recreating Tuskegee. So we should get the vaccine because it is a therapy that we now know works. The other part of that, of course, is that, as Heidi said, it's really for most people, it's not Tuskegee. People articulate that, but it's the fact that they were treated badly yesterday. It was reinforcing. And the lack of trust comes from that. So one of the reasons that you see physicians poll very high as trusted messengers, that's when you have a physician-patient relationship. Nurses poll high as trusted messengers, again, because there'd be a relationship. But when there is no relationship, then other trusted messengers, like community health workers, like physician's assistants, like nurses, like Mrs. Jones, who then need to be empowered to engage people with the correct information, are much more powerful over time. And by the way, now with the social media environment that we're in, there's a whole range of media influences, pro and negative, that have to be engaged. Because, you know, early on in this epidemic, we learned with great fanfare that this vaccine and this disease was a plot by folks like Bill Gates in order to be able to sell a vaccine so that they could put microchips in it so they can track us. And I mean, these are one of the wildest rumors that we had to push back against very, very early on in this outbreak.
It's been amazing, some of the rumors that are so wild that news organizations, including mine, have turned to things like fact checks that used to be employed in political journalism, now to try and set the science straight. We have a lot of questions from viewers about the role of science educators and science journalists in trying to combat the misinformation. And I do kind of wonder if that you're talking about trusted sources in your community. What is the bigger role of educators getting, more education about vaccinations in general? Probably, not going to help us right now, but what are the roles?
Well, they can clearly be helpful. I mean, I think the media, depending on where you are, plays a positive or negative role in terms of how they're viewed. I think that we need a concerted effort to get to conservative media and talk show hosts and talk media, radio, particularly radio talk media. They need a lot of work to get them to recognize the harm that's occurring when they're giving misinformation. You know, the politicization of this science is a real problem. And some of it doesn't make any sense. And again, Carol, you may want to comment on this because I fail to understand, because I've had this debate in conservative communities where people will say, I don't want, you know, the government in my water supply. And my retort to them is, so you want to get up every morning and have to boil your own water? Oh, no, 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 no. What we will do is we'll put together a co-op and we will solve this problem, you know, through a citizens council. And I say, but isn't that what government is? And so for me, the lack of connection of the dots, for me at least, is very perplexing for well-educated, very smart people who I'm not sure whether they're in the entertainment world or they're in the media world.
Right, exactly. Well, first of all, the way you have that conversation is a terrific way to do it. You don't say, what kind of an idiot are you to think that? You say, but look, you know, look, a community, that's called a government, okay? It's a way of having a conversation, of pointing these things out where, I mean, look, the language of I want to be free, I don't want to be connected to anybody, I don't want any government handouts, except of course for Medicare and Social Security and disability benefits and so forth. It's a way of pointing out what it is that you're already doing, but you do it in a way that finds a shared thing. I remember a friend of mine told me that she was talking with a very conservative neighbor who was really opposed to the to the mandate for health insurance. You know, everybody has to pay in for health insurance. Well, I'm healthy. I don't want to pay into insurance if I'm healthy. And she said, excuse me. She said, don't you understand how insurance works? I have not had a car accident in 25 years, and I am paying premiums for your son to get paid for all the damned accidents he's had. Oh, is that how insurance works? I mean, these are conversations on a one-to-one basis that might be productive, but of course it depends on the goodwill of both participants to really try to understand what it is the other person's thinking. On a social scale, on a national political level, where the polarization is so fierce, where you're taking a position that is contrary to to the other parties, you know, you're considered an evil person, a devil person, you know, it's not just that we disagree, but that you are evil, wrong, and horrible. Well, there's not going to be a conversation that way. So I think your point in general of finding conservative voices who will speak to other conservative voices is the best way to make inroads there. They're not going to listen to the liberal side. They're just not. But you find someone like you who can make the case.
So we have time for about one more question, and I wonder if you can all talk about what people should take away to their own communities in having these discussions. What should, whether you're a science educator, whether you're a journalist, whether you're Mrs. Jones, what should you do to try and learn more about the vaccines for yourself and get more information for yourself and for your communities?
I just want to flag one challenge too, which is there is an acute amount of polarization in many countries in the world, and that has certainly been part of what's contributed to such extreme polarization of the vaccine sentiments. And also, I mean, one thing I'd like to say to media, please don't use the term anti-vax, because it contributes to an increasing polarization. I think the risk of always finding people like us is contributing to the polarization. I think we need to get out of our comfort zone. So there's kind of two things. On the one hand, we know to get in and engage with communities, you need to find locally trusted people. But in general, I think we need to put our guns down and really get comfortable with, I mean, democracy is about having some room for some debate. And as you say, as Carol mentioned, I mean, this is true in vaccines. I mean, Le Monde, the French newspaper, said it used to be that we couldn't talk about politics in Gilets jaunes, the yellow jackets protesting in the streets. Now we can't talk about vaccines at the dinner table. And, I've had lawyers come to me about, people ready to go to divorce court because of their different vaccine views. And we need to get out of that and be able to have conversations. So I think that just the only thing I would flag is in our encouragement to talk to people that are trusted and that listen to you, one of the problems is the pro community is pretty good at talking to each other, but not so good at going out of their comfort zone. And I'll tell you, the contrarian, the questioning, the dissenting people are much better and feel quite emboldened enough to be there for everybody. And if you have 1,000 pro and 10,000 pro or 100,000 pro people and 1,000 questioners, against vaccine or questioning, they will split into 10 groups of 100 so they can get to as many different types of communities and anxieties and reinforce them. And we're not doing that enough. So I think, without contradicting ourselves, we shouldn't forget that we do need to have some difficult conversations. We do need to go slightly out of our comfort zone and find some people who not only are going to kind of reinforce the good stuff. We can't just go into communities and find the champions, because they might alienate the other side. So we need to look for the fence sitters. We need to look for the people in the middle and get those conversations going. And in general, I think politically as well as around vaccines, start to be able to have these conversations again.
It was one of the most plaintive questions that Elliot and I ever got about our book. How do I talk to Uncle Fred about Trump? How do I mend the rifts in my family about these issues pertaining to the virus, pertaining to anything, political? And in pain, in real pain, how do I mend fences? How do we talk? How do we communicate? And I think your point is exactly right. We are not going to convince the people who have spent now a year justifying their views about the virus and about vaccines and about masks, but we can reach the people who are ambivalent or who are open to listening, and that's where we should be directing our efforts personally and socially, communally.
Yeah, I would agree. We're in a democracy, and people need to recognize there's going to be differences of views, and that's true. But it's also very important for people to understand that SARS-CoV-2, the virus that causes COVID-19, doesn't have a political party, doesn't have a political view, does have an opinion about what it likes to attack and under what conditions it likes to attack. And so I think we have to remind people to keep focused on the problem. The problem is the virus, which is very apolitical and is out there and is real. And I think if we can, emphasize and focus on who the enemy is and not each other, I think we'd be a lot more successful. Now, I get frustrated like everybody else and want to use words that I can't repeat in front of my children or my grandkids or any other polite company. In fact, I can't repeat it in unpolite company either in most cases. Having said that, I think in these times, I'm an ER doc, so in these times of crisis, my advice is always take a deep breath, take your own pulse. And if you got a pulse, you don't have a problem. You've got time to figure it out. And I think we really need to step back and effectively figure out how we're going to communicate this tragedy that we're having right now, so that we can return to some kind of near normal, because this has really been a very disruptive, event in the lives of everyone on the planet. And going forward, life will be very different for a variety of reasons. I will be fascinated if next September Americans are a mask wearing society, because a year and a half ago we were not. But I wonder what it will look like next fall And whether or not people, we won't be mandating masks, I'm sure, but whether or not people will be like wearing a seatbelt and kind of the early stages of seatbelt where generally people walk around with a mask. And if they have a cold, they wear a mask. And during flu season, they're wearing a mask. And people will just do that inherently. And some percent of our population, I think, will be transformed. It remains to be seen.
You're practicing social psychology without a license. You're talking about changing norms. That's exactly what will happen when you find yourself as the minority non-mask wearer in a community where everybody's wearing it. It's going to get harder and harder for you not to wear that mask. So I do think that might be something we could optimistically look forward to.
May very well happen, but we need to do it faster than we did with tobacco.
We don't know. Well, we know people are dying, refusing to believe they're dying of COVID too, right? Okay, some people will carry that belief to the end. So we have a lot of challenges ahead.
Well, thank you so much to all three of our panelists for a really interesting discussion today on these challenges. Like Dr. Benjamin, I'm looking forward to seeing how we make it through these next months to year. And I'm going to turn it back over to Steve.
Right. Thank you, Lauren. What a fantastic discussion that went by way too fast. We hope you enjoyed this timely and deeply informative conversation. We had so many great questions from our audience, people all around the world, even in Congo. We greatly appreciate your participation. We'd like to thank our moderator, Lauren Niergaard, and our esteemed guests for making time in their busy schedules today. We'd also like to thank again our co-hosts for this event, the Howard Hughes Medical Institute's Department of Science Education. Video of this conversation will be online at pulitzercenter.org in the coming days, so please feel free to share. I'd also like to thank my colleagues at the Pulitzer Center, especially Holly Piepenberg, our producer for this session. And I'd like to remind people that the Pulitzer Center, we are a nonprofit journalism organization, so we depend on donor support. We ask those of you who are able, please donate today and consider becoming a Pulitzer Center champion. Our next event is tomorrow, Thursday, January 28th. Natasha Alford of the GRIO joins us to share details of her recently released documentary, Afro-Latinx Revolution in Puerto Rico. And you can see all of our upcoming virtual events, public events on pulitzercenter.org. I'd like everyone in our audience to please stay with us a few minutes longer, take a brief survey, help us make these sessions better and improve on them. And I'd like to thank you again for joining us, and we hope to see you again soon.